to my presentation on the strategic planning on nurse leader rounds. My name is Ancy John and I am a charge nurse at the Houston Methodist Sugar Land Hospital. I've been a charge nurse in this great organization for the past 13 years. The mission of our organization is to provide high quality, cost-effective health care that delivers the best value to our patients in a spiritual environment of caring using teaching and innovation. What is my strategic goal in this project? It's to conduct nurse leader rounds to ensure high quality patient care and increase patient satisfaction. Why did I choose to make the nurse leader rounds? Although the patient satisfaction scores on my unit are high, there is room for improvement. By making the nurse leader rounds, I would be able to assess the patient's condition. I would be able to decrease patient complaints and also validate some of the best practices of nursing, like bedside reporting and hourly rounding. And using the nurse leader rounds, I can also hold staff accountable for their care. So the benefits of the nurse leader rounds are as follows. By doing the nurse leader rounds, I would be able to build relationships with my patients and their families. I can also identify a change in the patient's condition and intervene appropriately and in a timely manner. Nurse leader rounds will also help me assess the patient's condition firsthand and make assignments appropriately. I can also initiate service recovery programs, receive patient feedbacks firsthand, and thus the nurse leader rounds will help enhance transparency in patient care. I would have challenges doing these rounds. Nurse leader rounds is going to take time, and I know it can't be done in a hurry. Also, when I make my rounds, patients would be sleeping or in pain, or they'll be stressful. So in this situation, I would go back to them and make my rounds. Also, I know I would be interrupted by phone calls and staff needing help. So I plan to put my phone on vibrate and then answer the call back. Depending on the situation, I would ask the staff to call me twice if they really need my help. Who are the stakeholders in my project? The stakeholders would be the nursing leadership, the physician leadership, the other charge nurses I work with, the staff nurses, the patient care attendants, the case management, and others involved in the patient care. So what is my plan? How will I go about with these nurse leader rounds, or how would I roll this project? I first of all would plan to do an opinion survey. I would send out a survey of 10 questions on the SurveyMonkey and gain the feedback from my colleagues. I would then create a sense of urgency by sharing how these nurse leader rounds would improve our patient satisfaction score. I would then assemble a team of stakeholders and would assign tasks to the leaders to lead the change. I would then create and communicate a vision of providing high quality patient care. Ongoing, I would empower the team and motivate them to hold this best practice. I would consolidate improvements with stakeholders, and when we get the positive results, I would celebrate with my stakeholders. And if this plan rolls out to be successful on our unit, I intend to get in touch with the leadership and my team members and roll it over to the other units. So in order to communicate this plan to all my stakeholders, I would first get in touch with my nursing leadership, and then I would ask for a mandatory staff meeting where I can present my plan to all the stakeholders in the form of a PowerPoint presentation. At the end of my presentation, I would ask questions or concerns or their feedbacks. For those who would not attend the meeting, I would have a face-to-face communication with them and share my ideas and thoughts and the plan with them. I also intend to give out handouts so it can be shared amongst the team. I plan to evaluate the strategic planning using the following methods. One, I plan to get feedback from my stakeholders, from the patients also and their families. I would look into the balanced scorecard to see how this project has increased the performance of the staff and the patient satisfaction score. I would also look into the patient satisfaction dashboards to look into an improvement. And I would keep a suggestion box asking the staff to give their positive and negative feedbacks, and I would have an ongoing continuous improvement on this program. At the end of my presentation, I always invite the stakeholders to give me their ideas, comments, and questions. And these are my references for the project. Thank you.